Physical therapists are trained to help people return to their normal lifestyle as quickly as possible. But if you're like me, you might not know that there are different types of physical therapy for seniors. Liliana Machuca with Nurses and More is back to give us an overview. And Liliana, this is such a wide-ranging topic. There are so many different types of physical therapy, but really the main thing is, how do we avoid the risk of needing physical therapy?
Physical therapy is the science that studies the body, the movement, and how to prevent injury, how to restore it, or how to make adaptations if you have permanently lost an ability.
Right, so it encompasses more things. You and I were just chatting about it. I think sometimes when we hear physical therapy, maybe it's after you've had a knee replacement or you've had some other bone situation or tendons, but it really is a wider range of therapies.
It is really very broad because it applies from the NICU unit, from the neonate age until you're dying. So it is very broad, it's beautiful, it's a wonderful field, and it really has a lot to offer.
And I think something that folks aren't aware of, we were talking about there are really basically 4 types of physical therapy. And the first one is the geriatric physical therapy, which would probably address most of our audience.
It does, and it's very important because we look at the individual that is growing older and how to keep them active for a longer time, independent. Independence is a key thing for physical therapy and in general for all the therapies available for the patients. And so definitely if you have access to it, ask your doctor to please refer you to one and learn how you can continue to be independent for a longer time and enjoy your life and enjoy your grandchildren, your activities, your dog, and Florida, the outdoors.
And that's the whole thing. When you have, now this is what I was familiar with, the orthopedic therapy. So, what's kind of involved there and what's the focus for orthopedic?
Just in a nutshell, orthopedic treats the musculoskeletal system, which is your bones, your muscles, and the soft tissues around them, and how to get you moving painless or pain-free if possible. So it involves from a shoulder replacement all the way to probably a tendonitis or things like that.
So whether you've had surgery or not?
Most definitely. Well, after surgery, what is an excellent surgeon without a good physical therapist? They can perform the most exquisite surgery to replace a knee, but if you don't do your therapy, if you're not proactive and you don't have a good treatment afterwards, you can lose what you have gotten from the surgery.
Sure. Now you were telling me there's also a cardiopulmonary type of therapy. Now, how is that involved?
Cardiopulmonary treats basically from deconditioning, from you not being very active for a while, whether due to disease or depression or any other situation, to things like COPD, which is, the problem with your lungs, and congestive heart failure, which is very prominent nowadays, and all sorts of problems from your lungs and your heart, and I would add there your vascular system too.
Sure.
How is your circulation, both venous and arterial? How is the supply? And we need to add there also lymphedema, which is a huge specialty in physical therapy nowadays.
Oh gosh. And then finally, the 4th type is neurological therapy. So what's involved there?
Well, with neurological therapy, we have specialties there too. And we treat things from ALS, MS, after a stroke. If you have had something in the past, but you lived with it, like cerebral palsy, and stuff like that. Anything that affects your nervous system, whether it's central or peripheric.
So it's a wider ranging idea when we hear that term physical therapy.
Most definitely. And you have therapists that are subspecialized in things, or they have had most of their expertise and experience in one of these fields. So I would suggest you go and you search for the one that has experience, the most experience in the area that you need at a certain point in your life.
Now, here I am. I've had a situation that I need to find a physical therapist. What do I, as the patient, do? What does the physical therapist need us to be aware of?
Two things. First, just ask your doctor, the one that is referring you to therapy, though we have now direct access in Florida, which is you can go straight to a physical therapist for an assessment, and then she'll take care of contacting your doctor for anything that might be needed afterwards. However, usually it's through the doctor. You ask the doctor what specifically you want the therapy for, and then you can call your insurance, you can call the clinic, you can call the nearby hospital and tell them, I want a therapist that has experience in this specific condition, and that's the first thing to do. The second one is just to know your therapist is going to be alongside you, but you are the main character in the whole situation.
It's up to you to
Most
do
definitely.
the therapy.
You know, there's nothing better than a motivated patient. Not always that you want to go and do therapy because you know it's going to hurt. Sometimes it doesn't always hurt.
But your outcome is so much better if you do.
Most definitely. And ask questions. Pick your therapist's brain, because a well-educated patient in the situation, it's an excellent patient.
Liliana, I so appreciate learning about the different types of physical therapy. Great information. Thank you.
Thank you for having me.